My name is Stacy Ocardo, and I am going to be talking about Trump Care and Obamacare and what I support or oppose of each one of them. On March 23, 2010, President Barack Obama signed into law the Affordable Care Act. According to Boehmer and Grimbach 2016, the House of Representatives and the Senate passed the Affordable Care Act without one Republican vote in favor of it. The Affordable Care Act has been attacked by many Americans and has also been referred to as socialized medicine. The purpose of the Affordable Care Act and also the goal of the Affordable Care Act was to improve access to health care and to provide affordable health care to those who do not have any. However, the Congressional Budget Office reports that the federal government spent $936 billion on health care programs such as Medicaid, Medicare, and the Affordable Care Act. In 2015, Medicare spending increased 7% and Medicaid spending increased 32%. That's a lot of increase on spending on health care. Paul Ryan, Speaker of the House from Wisconsin, reports that insurance companies are pulling out of the Obamacare due to the financial laws, that there was not enough healthy people to enroll in these programs to offset the cost of providing care for the elderly with chronic conditions. If you think about what happened with the Affordable Care Act, you have a lot of Americans who did not have insurance. They did not have any health care at all. Many of them have never been seen by a physician, and now they are given insurance and they're seeking health care. So you're finding a lot of patients who have uncontrolled hypertension. They have diabetes that's not well managed, or they have asthma that's not being managed. And it's very costly to treat these patients and to maintain their health. And it's very costly for insurance companies to do this. So a lot of the companies are having to pull out of the Affordable Care Act because they're losing money. The state of Iowa is actually down to one insurer, which defeats the purpose of the Affordable Care Act, because that's not a choice. If you have a state that's only offering one insurance provider, then you have no choice, and that is not what it was supposed to be. However, there are one thing that I do support with the Affordable Care Act, and as stated in the summary of the Affordable Care Act produced by Kaiser Family, it refers to the requirement of all insurance companies to provide 10 essential benefits, such as newborn care, maternity care, preventive care, such as birth control pills and cancer screenings, and it also requires them to maintain the management of chronic diseases. As we all know, in healthcare, preventative key is the key to keeping down healthcare costs. If you can give a patient a pneumonia shot, or if you can give a patient a flu vaccine, that is a lot cheaper than having to admit a patient with the flu or pneumonia, especially the elderly. That you're looking at a 7 to 10 day hospital stay, and that can be very costly for insurance companies, and it can be very bad for the patient. So if you can provide these services at no cost to the patient, I think that's a very that's a benefit. Providing birth control pills, cancer screens. I know there's no copay charges when a patient goes for their yearly exams, such as pap smears and mammograms. There's no copay to those, and that is something that has been a benefit to most Americans. As we all know, the insurance companies also used to have lifetime maximum payouts, where they were only going to pay a certain amount of insurance on you. Well, the Affordable Care Act has done away with that. So as long as you're paying your premium, you're going to have health care. That's very beneficial to patients who are receiving chemotherapy. If a patient's doing well on chemotherapy, those treatments can last anywhere for 2 years. And those treatments are very expensive. So for insurance companies not to be able to set limits on how much they're going to pay in a lifetime, and also to set limits on how much they're not going to pay annually, that is a benefit to patients. One of the things with Trump Care, there actually is not a lot known about Trump Care. I actually had to do a lot of research looking for stuff about Trump Care to see what exactly is Trump Care going to do. One of the things I do oppose with Trump Care is the defunding of Planned Parenthood. As noted in the summary of the American Health Care Act produced by Kaiser Family, Many patients that seek care from Planned Parenthood are those low-income Americans and those from rural areas. Planned Parenthood is providing cancer screens, it provides STD testing, and it also provides contraceptives. So if this program is to be is defunded, you're going to have many Americans, especially women, that does not have any access to health care. Because the patients in these rural areas, a lot of them, this is the only type of health care that they get. They don't have a general doctor that they go to for anything. They're seeking most of their care at these Planned Parenthoods, and then they can be referred out for anything else they need. So if this program is defunded, I think it's going to be a really big disadvantage to the healthcare system and to the Americans who are using it. There's still a lot of work to be done and to be worked out with the American Health Care Act, and it's very important for healthcare providers to be aware of what's going on so that they can be up to date on how to provide care for their patients, and they just need to know what's happening in healthcare. One of the things that we were asked to consider is healthcare a right, or is healthcare a commodity? And I kind of feel that healthcare, while it is every American's right, it is also a commodity, because a commodity is something that must be purchased, and if you want good insurance, it's something that you're going to pay for. So while it is every American's right to have access to health care, healthcare is also a commodity.